Hey everyone, this is Dr. Alan Chinosha with Town Center Family Dental right here in Hillsborough, New Jersey. And today I'm with Dr. Nana, Dr. Lauren, and Dr. Mark, and we are doing the Google Autocomplete interview. Okay, let's get started.
All right, first, will my dentist know I vape? You might not know you vape. We might be able to smell it on you because, believe it or not, you can smell that fruity smell. We definitely know if you smoke, and I could probably tell you about how many packs you smoke.
Also, we've noticed, a lot of the hygienists have noticed that they can see differences in the tissue when people vape, and so, you know, that's something to always consider, that it does have an effect on your
I'm not a
nose.
fan of this vaping at all. I'm just going on record right now. Not a fan. I think you're looking for trouble, okay? Don't be stupid.
Popcorn lung.
Popcorn lung, yeah.
Will my dentist remove tonsil stones? No. We do not remove
I've done that.
I've done that.
I've done that. You've done it too?
Yeah.
Yeah, have you
good
done
on
it?
a Ritz cracker. You ever have that?
Oh, come on.
Oh my God.
Yeah, I would.
Dr. Al will remove your
I've done
tonsil
that.
stones.
Yeah, so if you have
No
tonsil stones,
I've done that. Yeah.
just call me. It's easy.
Okay.
They're rather cheap.
Judge
Really
me.
not that hard to do.
Absolutely not. There's no judgment. Everyone's situation is different. Everyone's circumstances are different. We do not judge. We try to.
I think some people are afraid though. When they go to dentist, they're going to be judged. I know
Yeah.
here, as a group, we've all pledged no
No
judgment,
judgment.
judgment-free zone.
Yeah.
You know, we really believe in that. And I
Maybe
think,
sometimes somebody's really embarrassed of what
Yeah.
they have.
yeah, so I mean, you know, I'm no judgment.
No judgment. Will my dentist be mad at me? You
I
don't-
think that goes with, will
No
my
judging.
will my dentist judge me? I don't think we're
No,
mad
it
at
doesn't.
anyone.
No,
No,
listen.
we don't get
I'm
mad
going to
at
tell you a
If you
story.
bite me on
okay?
purpose,
No, I'm going to tell you a
I might
story,
be upset.
okay?
Go
I'm going to tell you a story, mention no names, where someone promised me they was going to be here for an appointment.
Yeah.
You know what? Maybe you know who I'm talking about. And said, I promise Dr. Al, I will not miss the appointment. I will be there. Okay? And sure enough, appointment time came, 9 o'clock in the morning, looking around, nowhere to be found.
Yeah, but that was your wife.
No. No, Mark. No, but I found him at Dunkin' Donuts, okay? So you can't hide, all right? You can't
Oh my
hide.
gosh.
Maybe you got the address screwed up.
Maybe. Will my dentist yell at me? Only if you're my children. If you're not related, we won't yell.
Yeah, it's tough being the kid of a dentist, right?
Yeah, but no,
Yeah.
your dentist shouldn't yell.
Shout out to my kids. Oh, another one.
We got.
Okay.
Oh, there's a lot.
Oh, you guys don't mess around here, huh?
How do teeth? You want to pull this? Don't you pull
Oh,
these? Go ahead.
gosh.
We'll take turns.
How do teeth
Grow.
grow? Interesting. So teeth grow, they start as little follicles, and it's a big complex thing, but basically it's little cells which basically keep dividing, and they keep growing, and they start from little follicles. So you have your baby teeth the first round, and then you get your adult teeth which grow under your baby teeth, and that's why you lose all your baby teeth and you get those adult teeth, because they keep growing from the little cells as you get older and older.
Very good. Very good, Dr. Nina.
How do teeth die? Oh.
Oh.
That's complex.
Ooh, there's a lot of answers to that one.
Yeah, that's
I mean, teeth can die from trauma, like if you get hit, or they can die from too deep of a cavity and it infects the nerve inside the tooth, and the tooth will actually die, which does not mean you have to lose a tooth, though. When the nerve dies in a tooth, you can still retain the tooth with a root canal procedure.
right.
So it's not the end of the line.
So you're saying that they're not dying like going to heaven or hell?
No,
They're dying, the nerve is dying.
The inside's
The
dying.
inside
Really, the
dies.
outside still has a nerve, not a nerve supply, but a blood supply.
So you can still keep the tooth.
Yeah,
usually.
yeah.
It's not like you're going to hell or heaven or anything like that with
Oh
your
my
tooth.
gosh.
That'd be bad.
All right. How do teeth
Get it.
get infected?
Whoa.
So that's a big one too. Teeth get infected multiple ways. Typically, if you have a big cavity or something that begins to infect that nerve the same way that a tooth would die, you can get an infection that way. You also your gums can get infected as well. So, you know, sometimes that's related with teeth getting infected. So there's a bunch of different
Yeah, I've
ways.
seen gums get infected that maybe has popcorn stuck underneath the kernel, right? We've all seen
Right.
that, and we've got to just fish it out. So, you know, the important thing is if you think you may have an infection, just get to your dentist. Don't wait, because it's never going to get better on its own.
Right.
I can tell you that.
Okay. How do teeth implants work?
Oh, man.
Let's talk to this one.
All right, so implants work. The basic simple answer is you're missing a tooth. A dentist will put an implant, which is a cylinder of metal. It's usually made of titanium. It's about this big, and it goes into the jawbone, and your bone grows around it, and then it becomes a new root that you could attach a tooth to, or multiple teeth. That's basically it.
And how do teeth get cavities? So teeth get cavities when we leave these sugars on your teeth, or
Who, we?
no, not we,
No.
but
You said we.
What? We as human beings.
we
Yes.
as human beings
Oh, okay.
leave things on our
We
teeth.
do that at the end
You
of every
mean
appointment.
if you have something to eat and you don't brush your tooth,
Right.
Right.
something stays there.
Something stays there. It interacts with the bacteria in your mouth, and it can cause that tooth to break down, and that's what typically a cavity is. And
Doesn't it kill you though? Some people come in, they don't brush their teeth, and they
never
never get
get
have cavities. Sometimes.
And then there are
And
people
yeah.
that have perfect
But they usually
home
have
care
bad gum
and they get
disease.
cavities.
Yeah, or
Yeah.
something. But
It's never fair.
Yeah,
It's
but
not fair.
it's not fair sometimes, right?
Yeah.
Nope.
So I mean, sometimes you just genetically program that you're more either
Yeah.
more resistant to cavities,
Or you're more prone.
or you're more prone to cavities.
Right.
And sometimes life is not fair, and it is true for teeth as well.
that's true.
So we're done with this, okay?
Good. Right over my head.
All right.
All right.
So what do we got going on here? What's this?
Why do dentists have bad teeth? What?
No,
Get out of here.
maybe.
I don't know any dentists with bad teeth. Yeah, that's what it says.
You know, there's some people with bad teeth. Okay, you know what? Hey, dentists are human too.
Yeah.
Okay, they're the same problems as anyone else. You can get cavities, you can get gum disease, you can have problems, you can lose teeth. But I can tell you, most dentists are in better dental health than the general population. I got to be honest with you,
Yeah.
from what I'm seeing.
Why do dentists remove?
Why do dentists remove wisdom teeth?
Oh, you just did it today, right?
Yeah, I just
Why'd you
took
do
one.
that? You took her wisdom teeth out.
I
Why'd
had
you
a
do
car
that?
payment coming up.
Oh, jeez.
A lot
No,
of times,
go ahead. Go
I
ahead.
was gonna say, a lot of times people say, well, the wisdom teeth aren't bothering me, why should I take them out? Well, at 18, 19 years old, if we look and we try to look into the future and say, are these teeth going to be a problem? It's a lot easier on the patient, it's a lot easier healing to remove the teeth when you're younger as opposed to someone in their 40s or 50s
Yeah.
who can have a lot more complications. So if we look at those teeth and think they're going to pose a problem in the future, we'll have to get them out sooner when the healing and
It's
the recovery is a lot easier on the
Yeah,
patient.
some of the problems is that they're just hard to keep clean, and it can hurt
Yeah.
the tooth directly in front of it that you don't want to lose.
Right, and the gums. as
So it's
well.
like preventive.
Yeah,
Yeah.
yeah.
Okay, let's see. Why do dentists talk to you?
I do that all
It's
the
the
time.
dreaded question. Why do we talk to you when we are?
I do it all the
working
time. I don't know. It's just, I don't know.
You're a captive audience.
Yeah.
You try out our jokes for stand up. I don't know. Nobody listens at home.
We're lonely.
I could. I like that no one listens at home, maybe. I don't
Nobody
know.
does
Yeah.
so,
Oh, that's not true for me.
no.
Shout out to
Go ahead,
Jerry. It's
Dave.
not true.
All right.
Why do dentists do fillings?
Why do dentists do
That's what we do, guys.
That's what we do.
That's
If you have a
right, yeah.
cavity in
Yeah.
your tooth, we remove the cavity, and when you take out the cavity, it actually makes a little hole, and then we replace the decayed tooth structure
Right.
with.
Okay, wait, no, I'm understanding the question.
ahead.
So, why do they do fillings as opposed to not doing fillings?
I think why do you do fillings to replace?
So, if you had a cavity
Right.
and you
Simple
didn't do
answer.
and if you didn't do a filling,
Oh, then
what
you,
happens?
you could end up needing a root canal. You could end up with the nerve
Or you could
dying.
end
You
up
could end up
losing
with
a
a tooth
tooth.
breaking.
So
or
you do a
cracking.
filling because you want to prevent
Further damage.
further damage.
Oh,
right.
I thought
Right.
you're
No, I'm just trying to figure out like why someone would
would ask why
Google
we would
that
ask
question
that.
because you know we take it for granted, but that's the reason,
Yeah,
right?
that's true.
That's the
That's why
reason.
we do filling.
Okay, that's a good question.
Go ahead.
What else?
All right, last question. Why do dentists use epinephrine?
What does it say?
Why do
Why
we
do
use
dentists
epinephrine?
I'm surprised.
A couple
that
of
came up
Oh,
with
that's a
top
good
list.
question. That's
One
Yeah,
reason
come
we
on.
use epinephrine is when we give an Novocaine to a patient. If it doesn't have epinephrine in it, it won't last as long as we'd like it to. We use epinephrine; it slows down the blood flow to the area, and the anesthetic just hangs around longer.
yeah, that's right.
Sometimes we use it for other reasons, like to slow down bleeding if we're doing an extraction or something. Those are the
We
main
just
reasons.
use it mostly to keep you as comfortable as possible. You know, the epinephrine
Wait, that,
definitely
oh,
helps.
one more. Okay.
All right. Will my teeth
Well,
fall out?
Oh.
baby teeth, yes. Hopefully, and your permanent teeth, hopefully not. We work together with you to make sure the teeth don't fall out.
But you know what? I don't know about you, but like some people have dreams.
That
Yeah.
the
You
teeth
ever
are
have dreams that
falling out?
falling out?
I've
I
had
mean,
that in my front teeth. I can take them out.
That means
It
something.
means you're gonna like win money or something.
Really?
I
That's
don't know.
not
I've read
right.
I
that.
know. When I was in school, when I was in dental school, I had dreams of my teeth falling out. I don't know if it was
The
from
stress,
the stress. Probably was a stress. I don't know. I think it's like loss of control. Dental school, not for the weak of heart.
No.
Not for the weak of heart.
Will my teeth shift without my retainer? Yes.
Definitely.
Yes, they will.
Yes.
It's a public service announcement.
Yeah.
This is a
Do not
very
wear
good
your
question,
retainer.
Google.
This is
Your
a great-
teeth
yeah.
will shift.
Yeah. Very-
No
Wear the retainer,
Wear the
or go to your dentist and ask for a permanent retainer, which is a bonded retainer, so you don't have to wear a retainer that comes in and out. You can get those.
Just have
Right.
it fixed in your mouth.
Yeah, just have it glued in.
Okay. Will my teeth grow back? Unfortunately,
Like you mean like sharks?
Yeah, we're not there yet.
Yeah.
Nah. Like the sharks have like how many rows of teeth? A lot of rows.
They just
right?
keep
You look at
growing.
sharks,
Just keep
yeah,
growing.
They
just
keep
growing.
rotating through.
Humans,
so
not
much
happening. Right? Two
No.
sets.
That's all you
Right?
get.
That's it. So don't screw it up, guys.
Yeah.
Just brush them.
Nothing's better than
Okay.
a factory original
Floss, not
Factory-
a brush.
Will my teeth get worse with age?
Oh
They
yeah.
will wear over time. I mean, it just.
Yeah, what doesn't?
I don't
But
think they get
exactly.
worse. I just think that if you take good care of them, then they naturally age, just like
The rest of us.
Yeah,
Yeah.
yeah. They age. Teeth age.
Mm-hmm.
all right. Last
Last one.
question.
Will my teeth hurt after filling?
Well, you might have some sensitivity to temperature, like cold mostly, or some heat. But most of the times after a couple of days it goes away. Occasionally it doesn't. It could mean that the bite is off a little bit on the filling and has to be adjusted a bit.
But typically, no.
Yeah,
Yep.
if you want to summarize.
Yeah,
Yeah.
but there's always the possibility.
Okay, that completes our first Google autocomplete interview. Look for the next one that'll be coming out soon.
Bye.
Look at a mess you made out of it.
I know I threw everything.